Dental Associateship Reflection Part 2. Hi, my name is Dr. Avi. In this video, I'm going to talk to you guys about an associateship position that I had early in my career. I feel like it's helpful for me to share my experiences so that way you can learn from them. Hopefully use it to your benefit and make the most of your opportunities. This is part 2 of my associateship reflection series. If you haven't seen part 1, go back and watch that first, and then I'll see you back here. This is about my second associateship. So, as you know, I got let go from my first job on my day off. And at the time, I was actually working in 2 practices part-time. I think this is a smart thing to do because it gives you 2 different experiences and ways to see how dentistry is done. It also allows you to learn a lot in both of these experiences. You will also not be at the mercy of just one practice, just in case they want to fire you on your day off or something, you know? So I actually found this job because the owner was my uncle. This office was a PPO insurance-based office. It was the second office that my uncle owned, and he recently opened it up. There was no hygienist in this office, and it was just gonna be me, and I was responsible for doing the prophies, exams, and all dental work that was needed for patients. My uncle was going to be in the office here and there, but primarily was at his other location. I took this as an opportunity to learn from my uncle, and I was super pumped for it. Starting out, he wanted me to work a couple days in the office to really help build it up. He admitted that there weren't that many patients, but thought it would be a good opportunity for me to learn and grow. Let's start with some of the positives. 1, the pay was great. I got paid a daily guarantee of $600 and also 32% production. Being paid on production is a great way to get paid as an associate. If you don't know what that means, check out my video where I go over how dentists actually make money. I talk about the different ways that dentists get paid. Another positive about this practice is I had freedom. So at this practice, I was practicing by myself, and this was a huge career milestone for me. My uncle was with me for the first week or 2, and then he ended up going on vacation, and I remember this moment so vividly. I remember he told me he was going out of town, so I asked him, okay, cool, I guess are we closing the practice? And then he asked me, are you going out of town? I said, no. So he said, why would we close it? You got this. And I was like, yeah, I got this. I was responsible to running the practice by myself. I was like maybe 4 months out of school. I was like, is this okay? Guess we're doing it. So another positive is being a dentist without the hygienist. This was good for me at the time because it allowed me to interact with patients and be able to work on my communication with them. So I really learned how to build rapport with them. Things like asking them questions, educating them about different parts of their oral hygiene. This stuff takes a long time to learn and no one actually teaches you. Let's get into some of the negatives. A negative about this patient was the lack of patients that I was seeing. Like I said, the practice was new, so the patient flow was not that high. This was concerning for me because this was my second job out of dental school and I'm still struggling to see patients. I really started to worry if whether or not I was gonna lose my hand skills because I was not doing dentistry. Another negative was I felt isolated in the practice being the only provider. I personally don't enjoy practicing alone. I like having another doctor in the office because it's someone that I can bounce ideas off of and lean on them for perspective. I also genuinely enjoy the company of a colleague. I didn't have that here, so a lot of my days when the schedule was empty, I would just be sitting around on my phone. So let's evaluate this associateship. Is the pay good? I had a daily guarantee of $600 with no expiration date, but I was not making more than the $600 in the production that I was doing. 2, is the office dynamic vibe good? The office vibe was okay. I was just lonely. 3, was I learning anything? I wasn't really learning anything because I was the only one there and I wasn't seeing that many patients, so yeah. So after about 4 months of working here, I told my uncle that I needed to find a job where I could see more patients. He totally understood this and he was supportive of my decision. I genuinely felt at this point in my career, it was important for me to just see patients and just do dentistry. I didn't do a residency program because I wanted to jump into the real world and get that experience that I needed to catapult me for the rest of my career. And I was out in the real world. I just was not doing any work. I knew I needed to change it, so I made a change. So I like to look at every opportunity that I've had in life as a learning opportunity. I learned that working in a relatively new office is going to take time to build. I learned that if a practice doesn't have a hygienist, it probably means that they're not busy enough to have one. Dentists should be doing dentistry on patients, not doing prophies. Hygienists should be doing the prophies because they're better at it and they're way more qualified to do so. If the dentist is doing the cleanings in an office, it probably isn't the most efficient business model. I also learned that working alone can be lonely, and it's not for everybody. It definitely was not for me. I also learned that sometimes mentorship can be offered, but may not always play out the way that you envision it to. And having a daily base guarantee is a good way to protect yourself and have some stability. What are some things that you can do to avoid a situation like this? Ask questions at the interview. Things like, is this an established practice? How long has it been open? How many patients are you seeing a day? Do you have a hygienist? Will I be the only doctor working? Is there an established patient population, or am I expected to build my own schedule? Will you be willing to work with me if I'm struggling to get busy? What is expected of me as the associate? These questions are going to help you paint a picture so that way you can know what is expected of you and what you can expect from the practice. I hope you enjoyed this video. Please drill that like and subscribe button and share with anyone you think may benefit. If you're wondering what I did after I left this job, check out part 3 and I'll go over that. Thanks for watching. I'll see you there.